Another recent study you led demonstrated that climate change can influence the risks of both benign and malignant urological conditions. So how does that happen?
The prevalence of kidney stones, which are already very common, will continue to increase as temperatures rise. We generate so much waste in the hospital and in the clinic. There are so many single-use products. I think one thing that surgeons could do is review your preference cards for everything that you do in the operating room.
Welcome to the final installment of our three-part series. Let's wrap things up with another great conversation. I'm assuming this was in part triggered by that experience that you had in Australia in terms of, this idea of climate change and the impact on urological health. You recently published a study which demonstrated that annual patient health related travel in the US generated a massive 35.7 metric tons of carbon dioxide, which is unbelievable and points to this idea of investigations and so on. So how do you imagine the US can reduce these emissions?
Well, certainly there's been a lot of investigation into telemedicine, to avoid more people having to travel in. And so that's an active area of investigation to see how that pans out. Certainly we hope that we'll be able to still get reimbursement for telemedicine to allow that to continue in the future, because it is currently only on an extension until September, I believe, at which point it will have to be voted again.
Okay.
So that's one thing. And then, like some of the things that I mentioned earlier, there are a lot of unnecessary tests that are being done. And so, coming back for another MRI at our institution when you already had one somewhere else, things like that are generating a lot of unnecessary travel and emissions.
Yeah, absolutely. And perhaps does it in part speak to your model of care and healthcare provision, and in terms of how the setup, you're sort of fighting against the kind of more commercial interests there, do you feel? Do you think that's part of the issue?
It's possible.
Yeah. Okay, another recent study you led demonstrated that climate change can influence the risks of both benign and malignant urological conditions. So how does that happen?
Well, what we talked about in that paper, it's really a review of all the ways that it can have an impact. And we grouped it into first order, second order, and third order. So there are some conditions where an increase in temperature will directly affect the risk of the condition. And probably the most well-studied example in the field of urology is kidney stones, where it is very directly related to the ambient temperature and to dehydration. And so many studies have suggested that the prevalence of kidney stones, which are already very common, will continue to increase as temperatures rise. So that would be an example of a first order impact.
Okay.
Then there are second order impacts where climate change will lead to other things that will increase the risk of urologic disease a little bit more indirectly. And then the third order would be things like hurricanes or other weather-related events that will become more common, that will disrupt supply chains and provision of healthcare and make it more difficult for us to provide the kind of care. And we've seen these things already. We've seen, reductions in cancer screenings in places after an extreme weather event. Even actually just, at the end of last year, there were these two hurricanes in the southeast of the United States. And because the IV fluids for the whole country are manufactured in that area, there was a shortage of IV fluids across the entire United States. So even though I'm in New York, we were nowhere near these hurricanes. We had to cancel some surgeries for patients with urological conditions because we didn't have enough fluids to perform the procedure, or rationing of fluids during the operation. And so you can see how just even a remote weather event that isn't even that's thousands of miles from you could actually impact the care that you're able to deliver and cause delays and cancellations. So all of these things can become more common. I should say there's a positive side, though, because there are mitigation strategies that can help the climate and urological health, such as
Yeah.
the plant-based diets that we
Yes.
talked about, because, meat and dairy both have really a very significant environmental impact. And even, people say, oh, do almond milk, does almonds use a lot of water? It's nowhere near the amount of water use of dairy. So less land use, less water use, less emissions, less eutrophication. I mean, you name it, across all these environmental metrics, animal products are more resource intensive. So I do think that we do have options with co-benefits, where if people eat more plant-based and less animal-based, they can reduce their risk of many urological conditions and also do something that's more environmentally friendly. Another great example is active transportation, cycling to work. I mean, this is good for physical activity, can help reduce cancer risk, improve cardiovascular health, and reduce your environmental impact instead of taking a car, for example. So I like to end on the positive note and think about, are there things that we can do where we can have a benefit for both? And it's a win-win.
Yeah, absolutely. So thinking about your fellow urologists, which they'll listen to this episode, they'll be completely sort of motivated to start putting some of this stuff into practice. How do they, and what advice would you give them to reduce that environmental footprint of their clinical practice whilst maintaining that high quality patient care?
Yeah. Well, I think starting with some of these basic lifestyle advice,
Yeah,
like telling patients to eat more plant-based and less animal-based food, encouraging active transportation. These are things that we should be counseling patients anyway, and those have environmental benefits. We generate so much waste in the hospital and in the clinic. There are so many single-use products. I think one thing that surgeons could do is review your preference cards for everything that you do in the operating room. There's a lot of extra stuff that is pulled for cases and that we don't end up using. So making sure to only open at the beginning the things that we really need and see if there are things that we don't have to open and throw out without using. So that's one thing. And then, thinking about the emissions of different testing that we do. Like I mentioned earlier, there are things like kidney stones or kidney masses where we do surveillance over time. Can we use an ultrasound this
yeah,
time instead of a CT scan?
yeah,
That is a huge saving. So if it's clinically acceptable, then that would definitely be a very important consideration.
yeah, absolutely. And thinking about the carbon footprints of all these procedures. Out of interest, what is the carbon footprint of a prostate MRI? Putting you on the spot, do you know?
Yeah, so we did a study on that actually. We looked
Okay.
at, MRI targeted biopsies because nowadays, both in the UK and the US, thankfully, we have these new tests that we can do to help patients decide if they're going to have a prostate biopsy. So it used to just be, the PSA blood test is elevated and we go to a biopsy, and a lot of them were false positives and we had a lot of negative biopsies. Now we have MRI as a possible triage test to help determine who really needs a biopsy. Now, the problem comes in that this is something that is very emission heavy, doing an MRI. And so, and that's okay if we actually use it as a triage test. And so what is now the common practice in the UK is that if the MRI is negative, then the patient does not have a prostate biopsy. And that can save a lot of extra emissions versus if you do the biopsy anyway, even
Mm,
if the MRI is negative.
mm,
And that is sometimes still the case in the United States. We have a different healthcare system and different
yeah,
preferences. Some people say, oh, even if the negative predictive value is, let's say, 91%, if there's a 9%
yeah,
chance that I could be missing a clinically significant cancer, I want to have the biopsy anyway. And so it's
yeah,
tricky, right? So, but
absolutely.
yep, but this is important. Every decision that we make has a toll. And, I think maybe what doesn't get enough attention is the fact that these emissions do actually come back to us. And so if you do one of these environmental analyses, it shows you the emissions and the water use and all of these metrics, but it actually also shows the human health impacts and just how actually doing a lot of unnecessary testing could increase the chances of people in the future getting cancer and other health issues due to things like, for example, if there's weather events and then there's leaching of chemicals from industrial facilities, and that gets into the groundwater. And so everything that we do is totally interrelated, and it all cycles back to our health and the health of our children.
Absolutely. And do you think part of it is about ensuring patients are informed, and that information includes, here's your prostate MRI or your surveillance MRI, but just to let you know, this is the carbon footprint for each of these investigations. Do you imagine us moving to more of that?
I hope so.
Yeah.
I think this should be a part of the conversation, and maybe some people don't care, but maybe some people do.
Yeah.
And I think it's an important part of the picture for people to know, and for those who it would make a difference, even if that was only a portion of the population, that would be important.
Absolutely. Great. And before you go, I've got to ask you for your comment on your ex-president, Joe Biden, developing advanced prostate cancer. Did you see that coming?
No, I mean, very sad,
Yeah.
but I think this is a situation that could come up, right? Because, the
Absolutely.
guidelines don't recommend routine screening after age 70 or 75. So,
Yes.
And it sounds like he, I guess, started having some urinary symptoms and went and got checked out. And as part of the exam, they felt suspicious nodule in the prostate, which led to further investigation leading to this. So, I mean, this is not a common situation. Many older men have indolent prostate cancers that are just there, but, unearthing them wouldn't help to increase their longevity and could cause more side effects. In this case, it's a very sad case where he really did have an aggressive cancer.
Yeah.
Now, who knows what would have happened if he had been getting screening? I mean, sometimes cancers that are this high grade are very poorly differentiated and don't even produce much PSA. So, it's impossible to go back and say, if they did a PSA a year ago, what would it have been and things like that. So I think there's, from a public health standpoint, I mean, it's certainly opened up the conversation here in the U.S. and people are talking about prostate cancer.
Yes, I'm sure.
So I hope that it increases awareness. At the same time, the guidelines don't recommend screening in the 80s for important reasons because it is felt to cause more harm than good at the population level. So
absolutely,
there is a risk where, a high profile case could lead to more inappropriate testing in the 80s, leading to harm to patients, having a biopsy where they get sepsis and then they end up in the ICU. So there's definitely, bad things that can come. I wish him all the best. It is really, truly sad news. And I hope that, thankfully we do have a lot better treatment options these days. So
yeah, absolutely. Well, Dr. Loeb, that brings us to the end of this episode, but it's been an absolute delight speaking to you about all things urology and environmental health related. But thank you so much for your time today.
Thank you.
And that concludes our 3-part series. Thank you for listening, and we'll see you in the next deep dive series. Until then, I'm Dr. Catherine Glass, and I thank you for listening to the EMJ podcast. Stay safe, stay well, stay curious.